First up, background on the bariatric patients that we serve. If we think about the larger patients in the community, these patients are often living on the health line. They're already been to hospital a lot of times, often. They're frequent flyers, you might say, to the hospital system. They're often very scared of hospitals and also shy to appear in public. So that often leads to them delaying their care, and they'll often come in after dark. And of course, you can imagine what that means for the hospital. We've got patients that are sicker than the next patient. They've delayed their care. They're coming in at a time where there's less staff. And so that sort of, you can imagine when they arrive at the hospital, the staff feel under-resourced sometimes. They'll fear, sometimes the staff will be fearful of hurting themselves, harming themselves. Of course, they want to do their best for the patient. But really this is the story of the larger patient, that right through their care they have barriers. In actual fact, we've come up with 50 barriers that are unique to a larger patient's journey. So some key ones, key things that go wrong are injuries to these patients. So they are ones that can have falls. They also have pressure injuries. Major one is loss of condition and mobility while they're in hospital. Really, and when they have these setbacks or encounter these barriers, this is what really contributes to them becoming more complex. And as they become more complex, they stay longer, they cost more, they end up being in ICU, and they're more likely to add pressure to the staff and to the resources of the hospital, including the higher risk of injury. So I guess they're really the highest pressure and challenge on the staff, and also the highest cost, if you think about that. So in summary, these patients do get injured. The nurses become very at risk of injury, and they become more complex.